Hi, my name is Dr. April Andrews of Alabama Performance Horse Services. Today we're going to start our how-to series, and we're going to start with our first session, which is how to take your temperature, pulse, and respiration. Horse owners oftentimes find themselves with horses that may potentially be colicky or have a fever, but are unsure how to check their respiratory rate, temperature, or heart rate. So today we're going to use our equine model here, Bubba, to kind of go over what to do if you think your horse may have a temperature fluctuation or a heart rate issue, or even potentially a respiratory problem. So generally first, I kind of assess the horse to sort of see what I think about. Do they appear in distress? Are they bright? Are they lethargic? And kind of go from there. First thing I do is take temperature. There's a couple different kinds of thermometers you can use. We kind of use the good old trusty shakedown mercury type thermometer. You can also use digital thermometers that can be purchased at your drugstore, and they're just your regular rectal thermometers. Some horses potentially like to kick, so it's always nice to kind of stay back around this way so that you don't get in the line of fire. But you'll just come around, move the tail to its side, place the thermometer in the rectum, and for the mercury type thermometers, you'll just hold it for a minute. For the digital thermometers, depending on whether it's a 30-second or a minute thermometer, it'll beep and tell you when it's ready. So you just check their temperature, remove your thermometer, check and see. Normal temperature should be 99 to 101, but no greater than 102. If you have a temperature above 102, you should contact your veterinarian. Next on our list is I usually check heart rate next. Normal heart rate in the equine should be between 28 to 44 beats per minute, with the average being right around 40. To check your horse's heart rate, if you have a stethoscope, you'll place the stethoscope in behind the left elbow, and you'll listen for a distinctive lub-dub. The horse's heart rate is typically slow enough that you'll hear 2 heart sounds, sometimes up to 4. So it's not that you're hearing a rapid heart rate, it's just too slow, it's just 2 beats together to make 1. Most everybody has a smartphone, so you can check with your smartphone. We usually listen for 15 seconds, take the number of beats that we hear in the 15 seconds and multiply it by 4 to give us beats per minute. The other place that you can check, if you don't have a stethoscope, you can always run your hand back in behind the elbow to check for beats per minute. If the horse's heart rate is either fast enough or strong enough, sometimes you can feel it against your hand. If you can't feel it there and you don't have a stethoscope, you can also come up under the mandible here, and as you roll your fingers across, right up underneath, you'll feel the vein roll up underneath your hand. If you'll just lay your fingers on it, you can feel the pulse bounce against your hand. And just like with listening behind the left elbow, you'll count the beats for 15 seconds and multiply it times 4. You can also feel heart rate stuff down in their legs in different places, but the most accurate spots are behind the elbow and under the ramus of the mandible. The third thing that we listen to is our respiratory rate. The horse's lung field kind of runs like a big triangle up their back, so you can listen across the lung field, but if it's not abnormal, oftentimes you won't hear any lung noise. So many times it's easier to watch their abdomen and count inhalation and exhalation through the abdomen, or if you can't get it there, you can also come up and just place your hand in front of their nostril and count the breaths per minute there. It should range between 16 up to 24 and even sometimes up to 36. The other thing, if you think your horse may be colicky or just slightly dehydrated, is to check gum color. It should be nice and pale pink and moist. If you put your thumb on it and release, their capillary refill time should be less than 2 seconds if they're well hydrated. So that's kind of a quick rundown on your TPR. Just remember, heart rate should be no greater than 44 beats per minute, respiratory rate no greater than 32 to 36, and temperature should be no greater than 102. If you have any abnormalities or think that your horse is in distress, please call your veterinarian.